on it.
All right. Hey, everybody. Welcome to the dojo. It's Natasha. I'm here with our special guest, Brad and Julie Bolter with Intefusion. They are your revenue cycle geniuses, taking it from the very beginning, from the insurance verification, all the way down to the payment and everything that happens in between. So I want them to talk to you guys today about how to find leaky holes in the bucket. What are some myths behind that? And then looking at main KPIs, sub indicators that help when it comes to the revenue cycle and its management. So without further ado, welcome Brad and Julie. Please share your story so everybody knows who you are and how you got started.
Thank you, Natasha, and welcome everybody. My name is Brad Bolter. I'm the CEO of Intefusion, and we are a medical billing solutions company.
And I am Julie Bolter, the co-founder and vice president of Intefusion. We're so happy to be here today. We're going to share a little presentation with all of you and hopefully help you to identify some of the potential leaky holes in your insurance reimbursement buckets. To tell you just how we got started in this business, it happened over 21 years ago. My family are the Katkey family, and we're the founders of Metagenics, which is a nutraceutical company some of you may be familiar with. But Brad and I were working at Metagenics, helping doctors incorporate nutritional medicine into their practice when Brad was able to identify, coming from a background in accounting and finance, which is his earlier career, he was with his auditing mind, I'd be able to identify a practice in not a fancy socioeconomic area, but a very robust, thriving practice, and able to identify the difference in why was that practice so successful compared to others. And it was actually the medical biller who understood and knew how to translate the language of insurance and the language of functional medicine services into the language of insurance and get that doctor and the clinic paid. So that was such a significant difference in other practices. And Brad came home one day and said, Julie, if we are going to help more doctors incorporate this kind of care and help more patients to access the care, we really need to start our own medical billing company. So it was born out of the desire and the passion to help people get access to this incredible type of care that many of the doctors that will be here today provide, or all of the doctors provide. And we were just very excited to do that starting in 2003. So we've been doing it for 21 years and successfully helping more patients and more doctors.
And so I'd like to add in the process, and again, thank you, Julie, what our ultimate passion was is really working with functional medicine providers in delivering that care. And in my analysis and being in and out of so many practices, I really distilled down, there were two things back then that limited practices from achieving their true potential. And it was either they felt like they didn't have the time to spend with patients or the money to hire that nurse practitioner or other provider or health coach. And again, what I found is a practice in I would even say a middle to lower socioeconomic area have the time and have the money to be able to incorporate what they wanted to do and deliver the care. And so that's the genesis of really that led us on this journey really in the 90s. And now we sit here before you 21 years later, wanting and knowing now how to help providers have the time to spend with the patients and the resources to get that next piece to deliver the right kind of care.
So Natasha, that leads us to thank you for inviting us here today. And we're so excited to be partnering with you and in alignment because our purpose and our missions are so similar. And so we're really grateful that you invited us to come today. And we hope that we'll be able to empower the physicians here today to improve their outcomes and help more patients.
We really appreciate it. It's my pleasure.
So just to get started, Brad, do you want to lead us
Yeah.
off?
What I can report back is, as it relates to insurance reimbursement, there is three things that really get in the way. There's a lot of misinformation, there's myth, and it's wrapped up in a big bow of fear. And that oftentimes prevents practices from either exploring or incorporating insurance in their functional medicine practices, or mutes a little bit or a lot of the success and the potential that could possibly be achieved. And so these are some of the common myths, as you can see, that we hear from our functional medicine partners or practices that we consult with. The myth that insurance either pays too little or doesn't pay for your services, or if you accept insurance, you can't offer the care that you really want to, or again, that you, if you're in the insurance lane, you can't spend quality time with patients.
And unfortunately, we know that that's not the case. Brad and I die 1,000 deaths when we hear those things, because we really want to help those providers to understand that that's not the reality that is in our experience. So over the past 21 years, we've been recognizing those myths and the big gap between the functional medical care and the healthy and successful insurance reimbursement. And we've learned how to close that gap and how to help doctors to be able to capture that revenue so they can really spend the time that they need to spend and help patients get well.
So what I can tell all of you is, really, insurance, I'm sure everybody knows, it's a combination of diagnosis codes and procedure codes and so forth, and it's its own language. And so what I can report back is providers, or specifically functional medicine integrative providers, are delivering the services, and I would say traditional or even allopathic billers don't really understand what's being done. And of course, as a provider, you're not schooled or versed or trained in codes, and so there's a loss in that translation. So oftentimes the biller doesn't understand what's being delivered truly in the treatment room, and the providers don't have the bandwidth, time, or expertise in how to appropriately code what's being done. And so we really, at the corest of our levels, see ourselves as interpreters, and we've become fluent. Number one, both Julie and I have had 20 plus years in functional medicine, so we know that space. And now, not to age us a little, but we've had 21 years in coding and billing. And so we're able to match that and communicate that and close that gap.
Exactly.
So these are basically the puzzle pieces. The reality is you get what you give. And so starting with the left, what I'm alluding to is when those services are coded correctly, insurance pays for the level of care. So oftentimes out there, you either hear this or you may be experiencing I like to say, delivering a level of care, but if the claim's not coded right, you're getting D level of pay. And so it's about making that, one way to say it is maximize, but I like to say make it commensurate. With insurance, the payment can be commensurate with the level of service you're delivering. The other piece is that you get to offer more of the type of care you're passionate about. I just want to say, when this is matched, you access more people in the community. In a cash only practice, what you're accessing is patients that either A, have the disposable income to pay cash for the services, and or B, prioritize their health in such a way that they make that a priority and do pay for it. When it's an insurance, when it's done the right way, and it's a copay or co-insurance, you access and have more in the community available to you to deliver the care that you're delivering. And then finally, even on the insurance side, the myth that we're going to bust through is you can spend time with your patients. And so part of what we do, and we've developed and as Natasha said, from the start, from treatment to collection, we have a 6-step proprietary reimbursement control system that helps initiate, integrate, and get payment on the entire process.
And that just goes to show that not all medical billing is the same. And so it's important to be able to identify where are those gaps for a provider, where are the myths in maybe a doctor's current billing situation. And we were hoping to give everyone some tips today to be able to identify that, help you possibly find some of the leaks that could potentially be in your boat, and begin to identify how to close those gaps and close those leaks. So one of the biggest myths that occurs today is people believe the payments are slow. It takes 30, 60, 90 days to get paid from insurance, and that is actually not the case. You might be shocked to find out that Medicare pays in 14 calendar days. From the date a claim is transmitted to insurance to the date the payment is in the bank account, we can count it as exactly 14 days. Commercial payers are across a little bigger of a spectrum, but it's anywhere between 2 to 14 days. It is not the 30, 60, 90, 120 day process in the main for the majority of claims. And the way to determine that is to look at your bank account, find out, what was the date of service, when did you see the patients, and when is your payment hitting the bank account? And you can determine that 14 days before that is when the claim was transmitted to insurance for Medicare, and for commercial payers anywhere in that 2 to 14 day range.
I'm sorry, Julie. What I can share with everyone out there is this is a common myth that we hear. And when we engage or take over a practice or consult, I'll often hear, I'm not getting paid for 30 days or 60 days. It has nothing to do with the payment cycle of the insurance companies. There's some other leak in the hose or the process, or something going on in the practice. And we always identify that.
One of the important things you can look at is just how patient demographic information is input and how that information is put into your system before a claim is billed. Because that would be the number one easiest thing to correct. If there's not a meticulousness in getting the correct demographic information and insurance information, that would be the thing that could slow the claim down from the very beginning. And that's a philosophical thing that you need to be aligned with your medical biller or the person that's doing that work for you, is to make sure that that information is excellent, actually perfect. Medical billing is really a 1-digit business. If 1 digit is off, if a date of birth is off, or 1 digit in the identification number is off, that claim is going to be slowed. It won't go through the process correctly. It will be delayed, and it would have to be worked on the back end of the AR, which increases the length of your revenue cycle. So that's the simplest thing to fix. And most people don't like to spend the time to get the correct information from their patient, to get a copy of the insurance card. Many times staff give you pushback on that. So that's a really key area of the practice to work on, and getting proper patient demographic information. A next step next myth in this is that cash only is easier and more profitable. I'm here to tell you that that is not the case. We highly recommend hybrid type of models. There are definitely cash services that should be incorporated into a successful practice, but eliminating the insurance piece is not the answer to a successful practice. Being a cash-only practice requires you to be an excellent salesperson. You not only have to continue to market your practice and get new patients, but you have to engage those patients in order for them to spend money out of their pockets to complete a very, possibly in some cases, lengthy and possibly expensive treatment protocol in order for them to get well. And sometimes, because doctors are so loving and caring and come from such a passionate place that they want to get their patients better, they resort resort to giving away free services, having telephone calls for free, spending a lot of their own personal time not being paid in order to deliver that care on a cash basis. The other problem is that when patients can't afford to finish their treatment program, they don't get as well as they could. And the insurance model is the exact opposite of that. Patients can afford to complete a treatment protocol. They get better. And what we see is practices are built upon this foundation of an insurance practice. People get well. They go out into the community. They tell their friends and family members, you can go to Dr. So-and-so's office. They take insurance. I got this, this, and that there, and I feel so much better. And so actually by having an insurance practice, it is a method to market to the community and grow the practice very quickly. So cash only is not easier. Incorporating a hybrid where you include the insurance reimbursement and you have the cash services that you want to offer is really how we find most practices succeed the most quickly.
And I'd just like to add there, sort of ask our audience a question. Do you ever engage with a patient and you have a successful outcome and you have somebody that's sick or in some level of dishealth or dysfunction, and you help them and you transform them, and they say, I'm just going to stereotype here a little bit, wow, my husband really needs this, but he just won't pay the cash pay or rate or see you. And part of what we do is when you are efficient and effective on the insurance side, you get to capture that patient, who hasn't seen the results or felt how good health feels. And so I just wanted to touch on that and have our audience ask themselves that question. Do you ever run into that? Well, the insurance side of it, and I always like to say, in the community, almost everybody has insurance either through their employer, through their spouse, et cetera. And so ultimately, this is about helping more people and reaching more people in your community. So that leads to the next step. A lot of the myth that we hear is insurance is so hard, the red tape, the timing. Well, what we can share and how we engage and what we want to model for you here today is the right relationship. An efficient billing partner does more than just sending the codes off. They help you navigate, they help you read the reports, navigate, solve problems, and educate the practice, the staff, and you. And so what we always do is we educate and empower. And I would say there's a lot of, that I alluded to, fear in this space, and a lot of, if you're, however you're engaged, that person should, again, be educating you, not instilling fear. And it really comes down to, we like to say it's the CPT code that gets you paid, the CPT code tells them what you do, but the diagnosis gets you paid. And so it's about being meticulous and matching that up. And a lot of the, I'll call it insurance dysfunction, is at a very low level. And so when these pieces are matched, it's not hard. And what I can say is you should engage with somebody who has a fire in their belly about insurance reimbursement and the care you're delivering. And I almost want to laugh here a little bit. We love what we do, and we communicate with each other at times in codes. And so that's the model. It's not hard. We love it. And the truth is, the right relationship is, in what we do, is engage from start to finish so that you can do what you do, and that's get people well.
I'd like to address the confidence versus fear, Brad. We hear so often that billers tell doctors, oh, don't bill a 99215, you're going to get red flagged. And this is a common misperception. There is a totally appropriate time to bill a 99215 or 99205, which is a high-level office visit, when you're dealing with a very complex medically, the medical decision-making is complex, and it requires a tremendous amount of time just to unravel the details of this complex health history of a patient and the medical decision-making that is necessary in order to address these problems. And it's completely appropriate to bill a high-level code for those types of visits. And so your biller should be able to give you the confidence of knowing when to mark and bill that type of code, how to document, because we all know really it boils down to, are you documenting what you're doing? If it's not documented in the insurance language, it did not happen. So that's really where you can have more confidence and less fear is, no, how should I document? And your biller should be able to give you tools to utilize in order to improve your documentation.
Right. Finally, the fourth most common myth is everything needs prior authorization. And I just want to hit this really simply. Medicare does not even have or issue prior authorizations for outpatient physician services. So no prior auth is required for your Medicare patients, and PPO plans, and it's with very few exceptions. I mean, less than 1 out of 100, and it would be maybe policy specific or patient specific. Most of this prior auth language comes from the HMO or capitated environment. And what really, I think this is the tip of the iceberg, when this myth is out there, the underlying, I guess, misinformation and fear is that somebody else is telling me what I can and can't do for this patient. And that is just not true in the Medicare and PPO environment.
So these would be some of the key indicators to look at if you're feeling challenged in your billing process, if you're feeling any of these things, to be able to go back, analyze, and address. And one of the things that Intefusion has done over the past 21 years is we've created a 6-step reimbursement control system, which is what you were referring to earlier, Natasha. Is that from the very beginning of the billing process all the way to the end, there are things that need to be done and can be done in order to maximize and make sure you're getting paid commensurate with the service that you're rendering. One of the first steps is we call a gap audit analysis. This is what happens when a doctor or provider walks into the treatment room with a patient and they perform a whole set of maybe services, and they then communicate a portion, maybe 7 out of 10 to their biller. And then the biller may or may not communicate all of those to the insurance company. So say the biller may fumble a few of those, and so they communicate 5. And then the doctor gets paid on half of the services that were actually rendered that could have been billed and compensated for. This is a gap audit analysis. Being able to have your biller go into that treatment room with you and say, what are you doing? Show me what you're doing. And then translate that in the language of the codes of the procedures and services you're forming. This is something that's critically important. And if that hasn't happened in your practice, you want to make sure that you have that done on a regular basis. Another area of the Intefusion 6-step reimbursement control system is patient encounter auditing. We do that on a daily basis, comparing the schedule to the encounters and making sure there's nothing missing. There are accounting systems of controls that we establish in all piece of this process. This goes back to Brad's accounting and auditing background at EY years ago. This audit and systems of checks and balances is established throughout the entire process from start to finish, so nothing falls through the cracks. Also, personal training. The providers need training on how do I communicate the services that I'm rendering, what is billable, and the staff needs training on how do I communicate the copay, deductible, etc. How do I communicate what a patient can expect from insurance at the front desk? And that's something that we provide to all of our clients. Collection systems. We have collection systems that help not only with collecting from insurance companies, but also with patients. Simple ways for patients to pay with QR codes and text-to-pay solutions, as well as creating, this is one area, the embezzlement protection that seems shocking possibly, but in our experience, we have found that most small to medium and even large practices really do not have controls over cash at the front desk. And there is a huge opportunity for possible theft. And unfortunately, that's just because it's the last piece of the business people pay attention to. And it's very important. We always say expect or inspect what you expect. Expect what you inspect, inspect what you expect. And when you have a system in place that people understand what they need to be doing, these things are not an issue. So we help with that as well.
Well, and I'd like to add, we were chatting with Natasha prior to starting our webcast, and those first three components of our system are really the KPIs, and they're measurable, and they're the things that you want to get right, Natasha, as we were talking about, that yield the results. And if we're not capturing all of the, that treatment door closes, and if there's 8 billable things and we're not capturing all 8, that's a problem. If we're not capturing all of the patient encounters and we don't have controls over the process, we're not going to get the results. And so we're whether it's marketing or the other systems in the practice that MedPro Dojo helps refine and create efficiencies, it's literally on the insurance side, it's those 3 steps that really identify, measure, and are actionable in these steps. So I just wanted to tie that in, Natasha, because we were chatting about that.
That's good, because we said, it's like, how do you find something? You can't find where the hole is if you can't trace it back to anything. So having those KPIs are critical.
Right. So I'll let Julie explain it. What if you get those right? What can happen?
This is the most fun KPI is the money in the bank account. This is an example of our results of taking over a practice, one medical doctor, one PA north of LA. This is the comparison of the cash from the previous biller versus Infusion 2023 versus 2024. This is from January to August. There's $287,988.46 more in the bank account in 2024 versus 2023. This is the direct result of that 6-step operating system and paying attention to all the little details. That's what really makes a difference. It's all the little things that make a difference in the entire process from start to finish, and that's what results in this kind of revenue and this kind of success.
So I want to highlight this example. We took over, it's funny, we're here in November, about mid-November of last year. This practice, single practitioner, MD with a nurse practitioner, didn't change her location, didn't add services. And part of what we did and what we began this webinar with was, how can we realize the potential? And so this is shoring those things up, incorporating our process. And again, our ultimate goal is Intefusion is infuse the practice with resources so they can reach more and deliver the care they want, integrate these practices into the practice, and do it from a place of integrity so that we improve patient outcome. And when that is done, this is the measurable results of our process and that work.
Exactly. So this is the reimbursement control system that we've been talking about, incorporates all of these 6 steps. And what happens is people compare data entry, medical billing companies or medical billers that are data entry. They're entering the data you've provided them, and that's the limitation of what they have to offer. And they think that is all of this. And that's where a big gap in understanding happens from the provider perspective. So it's really important to make sure that all of these things are being taken care of from start to finish. And that's where you get the results in the revenue that's commensurate with the service that you're providing. And it's a real meticulous attention to detail. And that's where the success happens.
So just to add on this, I think a lot of the misinformation comes from there's a lot of this, as you see, the half star out there, and that's where insurance gets tossed aside because the other things aren't being managed, done, incorporated. And so if I were to put it in healthcare terms, it would be like a patient coming to any one of your practices, maybe a chronic pain patient or a chronic fatigue, and they've been to a, giving it all due respect, sort of normal mainstream see you for 10 minutes doctor who says I can give you these 2 drugs, and they go, well, I guess I have to live with this. And so I would ask everybody, if you have that patient that finds their way to your practices is usually asking, you know what, I don't feel well, or this isn't right, and that's how it's that questioning and honoring their intuition that typically leads them to seek out care from practices like yours. I really see it the same as insurance. If you're feeling like the patient, you know what, I should get more, there should be more there, I'm doing more, it's because it's the half star versus the 6-star process. It takes the entire process to, Julie, if you could tick back one slide. When you do this process, this is what happens. This is the optimal health, the proper functioning, the results. This is healthy.
I would say, Natasha, also, like we, as you know, we guarantee a 20% increase when we take over the medical billing for a clinic.
Yep.
And in 21 years, we've never, I would even take it one step further. We guarantee a 20% increase, or we'll charge the clinic whatever they were paying before if it's less.
Mm-hmm.
And in 21 years, we've never ever not accomplished this because of all these steps. So having said that, and wanting doctors and providers that are here today to take away some nuggets, some tips that can help them, is that if they pay attention to those details in their own process, they will increase their revenue.
Mm-hmm.
And the problem is most people don't have a who can do this.
Yeah.
It's not, if we're always asking the question, how can I get this done? Many people don't have the time. So they need a who that can help them with it, and their biller should be doing that for them. So we really are grateful for the opportunity to be here today, and would love to open it up to any of your listeners here today that would like to ask us questions. We want to close with, our passion is better revenue for our clients, better care for their patients, and a better life for everyone. This is our QR code that would lead anyone who would like to look up our website. But we would also like to provide you with our phone number and let everyone listening know that we would be happy to provide you with a free 20-minute consultation. If you have questions that are specific to yourself and would like to engage with us later, we're happy to provide that, and we're happy to stay on and answer any questions anyone has here as well.
Yes, good, because I have a whole bunch of questions I've been writing down. So
Oh, good.
Great.
because that's me. I'm just the big note taker and lots of questions. So how many codes do you think providers are missing just in the day one consultation portion in your history of doing this? How many codes do you think people are missing?
I would say it really, that's a great question. It's even bigger than that. It's even how sometimes they set up their initial consult. So it could be, if I gave you a specific, could be anywhere from 2 to 4 codes, but it may even be that they're using the wrong codes, or they're even setting up that initial consult under some misinformation and myth of what they even can do. So in that set up. So it really depends, but
we're constantly, Natasha, we're constantly hearing the statement, I did not know that was a payable code.
Exactly.
And it could be something as simple as a Snell and eye chart that is done frequently, or maybe could have been or should be done, but they stopped doing it because they don't believe that it's a payable service. And so that's where that gap encounter analysis is really important, to find out what's actually happening. What do you want to give? What does your patient need? It starts out with what is medically necessary to deliver, and then it expands from there. And then the codes develop like, oh, well, that's billable and this is not, or etc. And just really parsing it out and understanding.
That was one of our first conversations. It's like when you were talking about, well, what do you do? Well, tell me what you do in that part. Well, you can charge for that. And they're like, well, what? And then you did this next, and there's a CPT code for that. And then realizing that those CPT codes have a specific dollar amount that's associated with them. If you're missing 2 to 4 codes, depending on the dollar amount associated with each of those, you can see, then you multiply that times, say you have 20 new patients in a week, or 120 encounters. That begins to add up, and that's how you're getting the over almost $300,000, where no staff change, no processy, besides what you guys are doing, changes, but the efficiency in making sure that literally everything that was done has a CPT code associated with it. But it's the ignorance, is the not knowing, not that you're dumb, or not that the provider's dumb. It's just not knowing and the missing of the opportunity. So, you've already helped one of our clients, attract in 17 grand plus, just in a month with working with them. So kudos to you guys. Also, what type, you guys talked about functional medicine. I know that's your background, because we do have functional medicine clients. What are some functional medicine type services or codes that you guys are billing for in other practices?
I could say some of the most common areas in general. I always like to start out with, what we love is, what's the next thing that you want to deliver for your patients? Our role is to vet that out, be able to bill it where appropriately and medically necessary. So there's no limit, but the most common things that oftentimes people believe aren't reimbursed are things like hormone pellets, IVs, health coaching, could be allergy testing or joint injections. Those are I would say the common services that a lot of the people in the functional medicine space typically don't understand can be reimbursed.
Mm-hmm. Yeah, that's awesome. And, you guys had talked about, we were talking about earlier, buckets, is that it's once you, if you're doing billing in your office, you have one bucket, but now if that billing goes out to an outside biller, there's another bucket. So there's different holes that we're trying to mend. And it's hard to do that sometimes when you have an outside person doing your billing. But what I liked was your 6-step process that ensures that those holes are almost completely diminished, or you start out with a new bucket and it stays pretty full, and that's filling up and being able to pay the clients. Let me see.
To your point, one of my favorite things about doing what we do is it's measurable. If we're doing our job, you should see that revenue increase. Oftentimes other things, probably all the practitioners, you have ways of quantifying, whether it could be a metabolic screening questionnaire or labs. It always helps to be able to quantify, and it's clearly quantifiable. Like earlier Julie said, in one of the points, look in your bank account. Like if the person handling your billing, and conversely, the mutual client that we have, he looked in his bank account and there was nothing. So knew there was something wrong. But anyway, it's measurable. Our results are measurable, and our clients see it.
Yeah, I mean, that's the hardest thing when I'm looking at people's KPI sheets, stats sheets, things like that. And I'm looking at how much of production was done versus actually what they're collecting. There's a huge gap. Some offices I've seen millions of dollars, like you produced all this stuff. And yes, some offices hyperinflate the billed amount to what they're going to get reimbursed, but still that's a huge gap in between. That could be the difference of, being able to retire sooner or hire more people.
Right.
Exactly.
So what other questions does any of our friends out there have? I don't want to hog up the whole time, but I love this kind of stuff. I'm like, ooh, how else? What else? So any other questions, if you guys want to type them in or just turn off or take off the mute and ask the questions, we'd love to be able to pick Brad and Julie's brains here while they're here.
While we're waiting, we are also going to be at the A4M conference in December in Las Vegas. If anyone's coming, we'd love to see you there.
Okay. When is that?
That is, actually, I have the dates right here. It is December 13th through 15th. It's in Las Vegas at the Venetian. It's the A4M conference this year that is called Longevity Fest, and we'll be at booth 9123 if anybody happens to be coming out to A4M.
Oh, that's awesome.
It's a big conference. There's quite a few physicians and of course exhibitors that attend. So we're hoping to meet some of the MedPro Dojo people there.
Yeah, that's awesome. Okay, so since we're not having any questions pop up here, I wanted to kind of make a statement. So the integrated offices that we work with, and I'll just list off a lot of the things and you can say, oh yeah, we're familiar with that. So IVs, allergies, injectable hormones where we do a blood work ahead of time. We usually charge cash for that. Regenerative medicine, PRP, exosomes, could be hyperbaric chamber, wound care. What else? What are some of the other things? Neuropathy treatments. So with those service centers, what are you guys seeing commonly billed or things that you can bill, even though a lot of offices see those as cash only type of services?
I would say yes to everything except exosomes and the hyperbaric chamber. This is a great example of, on the insurance side, as functional providers, we know it can affect all sorts of things, but on the insurance side, for example, it would be more of right in the lane of stroke, any kind of head trauma, those kinds of things for insurance reimbursement. But everything else you mentioned, from allergies, wound care, PRP, IVs, etc. Again, assuming medical necessity, which is of patients with problems, just especially the IVs, I want to identify as some of the hangover things pop up, even in hotels in Las Vegas. This is in the medical clinics. That's a reimbursable service, for medical conditions, etc.
Okay, Dr. Brad, go for it.
So I'm bringing a couple of service centers into the office here within the next month, like home patient monitoring and expanding my DME. I've had a separate entity that's been credentialed with Medicare for a couple of years. I just haven't touched it. And then pharmacy. I used to have my clinics registered with their NC PDP number and all of that. And I'm hearing that the formularies have opened back up for the state of Arizona to make it favorable. But would you guys assist, I guess, in maximizing like the home care management and DME? And then I'm not even sure about the pharmacy. Usually the pharmacy companies that you go with kind of control a lot of the billing that you do. But
yeah,
anyways.
Definitely. Dr. Forbes, what type of physician are you?
I'm a chiropractor, but it's an integrated office. We got MD and nurse practitioners.
Fantastic. So the remote patient monitoring you're talking about is yes, and DME as well. As long as you have if you're working with Medicare, you have to be contracted specifically for DME. It sounds like you already have that. And remote patient monitoring, we're very experienced with. Those are very, very good revenue streams for a practice, and very down the middle of the lane as far as insurance reimbursement goes as well. And so I highly recommend those two areas for improving patient care and improving revenue to the practice. It's something we can definitely help with.
So one of my big questions with that is my practice is very season based. I'm in Mesa, Arizona, where I have a lot of snowbirds, and I want to maintain contact with my patients during the off season through remote patient monitoring. And I'm hoping that it would increase my retention rate for whenever they come back in town for the snowbird season. In your experience, do you have patients that are on the remote patient monitoring for extended periods of time? Is insurance okay with that? And will it achieve what I'm hoping to achieve with maintaining patients in that way?
That's a fantastic question. Every payable service is based upon diagnosis and medical necessity. So for those patients who are, a distance away from you that you have set up on remote patient monitoring, they would require the medical need for that service in order for it to be paid by insurance, obviously. And I do believe that would be a way to stay very well connected with those patients, because it does require a number of different moments of interaction with either the physician and or the physician measuring and reviewing the data that comes from that remote patient monitoring, and then potentially even reaching out to that patient and directing their care. So I think it would be a fantastic way to achieve that goal for you.
And just to add, and did I catch, is your first name Brad?
Yeah.
I mean, in my opinion, one of the top names anybody could ever get. So, so just to add to that, Dr. Forbes, I could see that also, with telemedicine, they could have, as part of the remote patient monitoring, I could see a setup where you're also reporting that findings and staying engaged with them via telemedicine, in regards to reviewing and or adjusting anything based on the metrics. So that could really work. I did want to address the pharmacy is a completely different lane and outside of our expertise, and a different channel of billing. So that would be different. But the DME and the RPM, absolutely.
Cool. Thank you.
Very good.
Really great question. Do you have an RPM company that you're currently considering or working with?
Yes. Trying to remember the name of them, but yeah. I do. I can't remember. I just signed contracts like a month or so ago, but I haven't integrated it into the office. I'm still trying to work on some of the systems and documentation.
Right. There should be a very simple method. They should provide you with a simple method for your biller to know what was done and what needs to be billed. And then you have your documentation, or the medical personnel's documentation has to be there as well. But feel free to reach out to us if you need support in that area. We have experience and be happy to help you.
Awesome. Thank you.
Yeah. Great question.
And great name.
All right. Any other questions?
I would say, how can we get started if people listen to this recording and they want to, reach out to you guys? What's the best way to get in touch? And how can we forward that information to them?
Thank you, Deanna. Great question. Well, please call us on our office line at 949-716-6829. You can ask to speak with Angie to schedule an appointment with Brad or myself, and our team will love to reach out and help anyone that we can.
And this QR code takes you right to our website, and you can contact us through that, through our website as well.
All right. Well, we so appreciate you guys. I love your guys' heart, your philosophy, what convicts you to do what you do in this space, helping so many different providers in the integrated space, the medical space, and just overall. So we thank you so much for your time today and all the wisdom that you've brought. So again, if you guys need anything, please reach out. We'll get a phone number included for you, as well as the QR code. Thank you for each one of you to carve time out of your day to be here with us, and hope that you found value in that. So thank you so much, and we'll see you on the next dojo.
Thank
Thank
you,
you,
Natasha.
Natasha.
Okay.